Well, I'm glad because that performance is pretty bad, and the national average is about 30 or 32% of vaccines distributed, and that's nothing to be proud of. So the fact that we're lagging the national average is terrible. And California typically does pretty well on these sort of comparative measures, and so there's something very wrong here. I'm glad that Mark is setting a target, and sometimes when you set a target, you'll go out and figure out what you need to do to reach it. And so I'm quite confident the state health department is out there now trying to figure out what is the problem. And it's a complex problem. Some of this was the holidays, but they had the same holidays in Tennessee as we had in California. So, but I think it was a little bit of a sluggish start because of that. Some of this is the fact that particularly Southern California is experiencing a massive surge right now. And in many cases, the same entities that you're counting on to run big, complicated vaccination programs are also taking care of hundreds and hundreds of really sick patients with COVID. And we have to do both things at the same time. You can't say, well, we're just too busy, we don't have the people to do vaccination. If you're the health department, you need to say, all right, we're going to build another vaccination program outside of the health system. All the doctors and nurses are busy taking care of sick people. So this weekend we'll be in the football stadium, and we have found people to give vaccines, and we're hiring dentists and pharmacists and others to do this. So got to be more creative. We have to put resources into this. I mean, this is the most important problem currently in the world. And the faster we get people vaccinated, the more lives that will be saved. So we thought that if you'd asked 3 weeks ago, I don't know that anybody would have said the bottleneck here is going to be that last mile of getting people injected. I think we all thought that, of course, it's not going to be 100%, but you will distribute 70 or 80% of the vaccines. I don't think anybody thought we would be at 25% distribution. That means 75% of the vaccines are sitting in refrigerators and freezers right now. And that's scandalous. I mean, that just has to be fixed.